Good afternoon, everybody. I'd like to welcome you to the December meeting of the System of Care Leadership Learning Community. For those of you who aren't familiar with the learning community, we provide for you a forum to address issues that are particularly important for new System of Care expansion grantees, but all are welcome to participate. And we focus on topics during the year, such as evaluation like today, others like financing plans, social marketing plans, family and youth involvement in your expansion initiative, and others that are of interest to you as you undertake these new initiatives for your 2016 grants. You are free to involve anyone in your team who would like to participate, and especially when the topics are relevant to them. For example, today, such as evaluators and family leads, youth leads, and anyone that you think is an important part of your team who could benefit from the particular topic that we're dealing with on that day. We'd like to have as broad participation in this as we possibly can. So everyone is welcome. I'd like to mention that the next System of Care Leadership Learning Community meeting is January 18th, the same time, 2:30 Eastern Time. And that one will focus on developing your social marketing plan, which is due at the end of year one of your grants, and also on Children's Mental Health Awareness Day coming up in early May, and how social marketing activities related to Children's Mental Health Awareness Day can improve your communications and your strategies for expansion. For today's learning community, we're going to focus on the national evaluation, and your questions are on the national evaluation. Here are the objectives for today's meeting. We have Abram Rosenblatt with us, who's the project director of the national evaluation at Westat, and he will review and clarify the national evaluation's components, what the data collection process is and timing, and also we'll be focusing on the differences between the national evaluation and the data that you're required to submit through SAMHSA's TRAC system on the National Outcomes Measurement Survey, the NOMs. So we will allow a lot of questions and answers on this. You did have an overview and welcome orientation webinar that was done by Westat in October, but we felt given the questions that you all have around evaluation, it would be a good addition to have another opportunity for you to ask questions and to have some issues addressed that you may be grappling with around that evaluation. The national evaluation team is shown here. Today, Abram Rosenblatt will be the one who is presenting information on the national evaluation and answering your questions. We also are fortunate to have with us today Jessica Taylor from Westat, who is the person who is a contact from the TRAC system that is collecting the NOMs data, and you'll have to provide the information through the TRAC system. And she'll be here to answer questions and share some information about that and how it differs from the national evaluation. We would really like to make this learning community meeting as interactive as possible, and we have a large group. There are 75 people registered for it. So what we'd like to request is that when you have questions or comments, we would really like you to put them in the public chat box that everyone can see to the right of the PowerPoint presentation. When you do that, we will moderate and facilitate and make sure that your questions are addressed by Abram and Jessica. And then with time allowing, we will open up all the lines, unmute all the lines at the end, and allow some dialogue that way as well. We hope that that can be managed with a large group and that everybody will be careful not to talk at the same time as everybody else. But in the meantime, to get started, it would be great if you can put your questions or your names even in the chat box, and we will recognize you and ask the presenter. You missed that, is that what we'd like to do is encourage your questions in the chat box, and if you put them in the chat box, we will moderate the discussion and make sure that our presenters are able to respond to them. At the end if we have sufficient time, we will unmute all of your lines, and then you will have an opportunity to ask questions verbally. But with such a large group, we thought that the most efficient way to do this would be if you enter your questions into the chat box directly, and we will ensure that our presenters go ahead and answer them. We did want this to be as interactive as possible. I mentioned before that there was an orientation webinar on the evaluation in October that I'm certain most of you participated in, and this learning community collaboratively between the TA Network and Westat wants to provide you with an additional opportunity for Q&A and to be able to get responses to any issues and questions that you're dealing with as the national evaluation begins data collection. So I'm going to turn this over to Abram Rosenblatt from Westat, and I also mentioned before that we have with us Jessica Taylor, also from Westat, and she is working on the TRAC system that also collects information on the National Outcomes Measurement System, or NOMs, through Westat, but that is separate from the evaluation. So we will have the ability to ask questions both on the evaluation, how it's different from TRAC, and the procedures that you'll be using for both. So with that, I'm going to turn this over to you, Abram, to give us a quick and dirty overview of the evaluation, and then we can move into the interactive portion of what we'll be working on today. So, Abram?
Great. Thank you very much, Beth. And as Beth noted, I am joined here by Jessica Taylor. She is the project director here at Westat for TRAC. And at the end of the presentation, we'll make sure you all have some email addresses that will let you ask your questions to our 24/7 help desks. They actually aren't staffed 24/7, but they are available 24/7, and then we'll all be able to get back to you right away. Many of you, it looks like online, have participated in one of our introductory webinars. So for those of you who have, welcome back. We hope this will add additional information. For those of you who have not participated, welcome. We're glad to be on board with all of you at this exciting time for this initiative. So I'm going to go ahead and provide a basic overview of the Child Mental Health Initiative National Evaluation. Overview is really oriented toward the 2015 and 2016 grantees, as Beth noted. If you're a 2013 and 14 grantee, please feel free to stay on the line because there'll be a lot of useful information, especially about TRAC here, and you might be interested in how the evaluation looks for the 15 grantees. It's slightly different, though there is quite a bit of overlap. So we do have our National Evaluation Team leadership here on the screen for you to see, and we're very fortunate to have Anna Maria Brandon, Beth Stroll, and Garrett Moran as our senior leaders and corporate officers. We have a number of terrific partners who work with us on the national evaluation. We have the Federation of Families for Children's Mental Health, Youth Move National, DMA Health Strategies. They do work with us on financial mapping and financial data collection. You'll hear more about that. Walter R. McDonald Associates, who is actually taking the lead with us on a report to Congress, and the University of Washington, who provides much technical assistance. So our evaluation does have a purpose, and so I'd like to go ahead and give you a sense about that. We are hoping to assess whether system of care services and supports were expanded, and how expansion was implemented compared to how it was planned, and how expansion changed in response to barriers or facilitators. The point of this slide is to begin with our focus on expansion, which is a key element, as you all know, of the Child Mental Health Initiative at this point. This is a somewhat new part of the evaluation compared to prior iterations that have been done with prior grantees. And so I want to just emphasize momentarily that we are focusing on expansion in your expansion process. However, we also realize that it's very important to understand the outcomes of the services you all are providing. And so we are focusing also on health and behavioral health outcomes, on educational attainment, living environment, social connections, and quality of life. We know that many of you have questions about how we're collecting those data. I'll give you an overview. And that is also where the TRAC and NOM system come into contact with the national evaluation. We want to look at whether expansion and impacts vary by the type of award. So for those of you who are 2015 and 2016 grantees, We are interested by whether you are a state grantee or a local grantee. And we want to look at factors that are associated with successful expansions that hopefully additional sites can learn from your experiences. We do have a framework for the national evaluation. It's really based on work that others have done, including Beth, on the factors that seem to really predict positive expansion and positive outcomes through expansion. Understand, if you look at the left side of your screen, that there are many different levels of supports for expansion efforts. We've categorized these into the service and delivery and practice level, the state and system level, and the local system level. So we endeavor to measure those three levels in our work. We have a strategic framework that you may want to just keep in your mind as we go through, because our measurement is designed around that framework. Our frameworks include policies and partnerships, services supports, financing, training workforce, and strategic communication. Again, you'll see those come up as we move along in our design for our instrumentation. Then we're looking at a variety of outcomes, including the expansion of systems of care, improvements and increases in services and supports, and improved child and family outcomes. All of this is based on system of care principles, which underlie both the way in which we do our work and the design of our measures. So this table provides an overview of our instrumentation and measures, again, for the 2015 and 2016 funded sites. We will be doing introductory conversations and documents review with all of you who are new, and that will be our first opportunity to have contact with you. That's a really informal conversation. Then we'll also be doing semi-structured interviews that we call key partner interviews. We'll be doing those with those of you who are project directors and with your key partners, including youth and family members. We will do that both at state and local levels, and we plan to do those in the second and fourth years of your grants. We'll also measure a number of our dimensions, as you can see in the middle column there. We are doing financial mapping and benchmarking. Both are ways of looking at financing. We're trying to understand how you finance your systems and also what the costs of your services may be, and try to get some sense about what return of investment might look like. We've done a couple of webinars on benchmarking and financial mapping, and we'll have more on return of investment in the fall, or actually in the spring. And then finally, we have a quantitative web-based data collection mechanism called the System of Care Expansion and Sustainability Survey. That will also be done with project directors and your partners. It is going to be done across all the analytic dimensions. We hope to do that in year 2, and because it's web-based and relatively efficient, we plan to do that annually to see how things change over time as you develop your services and systems. We do have a child and family outcome study. We have several measures that are part of the child and family outcome study. However, our measurement package for the child and family outcome study is relatively brief, especially compared to prior evaluations. We did that on purpose. We understand that you have local evaluation needs and requirements. We understand also that time is very precious to all of you in your work. And we also have picked measures that are easily accessible and free to administer and don't require special scoring protocols to try and make it as easy as possible to implement these measures at the local level. We plan to get those going as soon as possible. We have OMB approval for those measures. We do not have them yet for other parts of our evaluation. So for those of you who are 2015 sites, we are going to be getting you going as soon as possible, and some of you have already began. And for the 2016 funded sites, we will be providing training on those measures, additional training actually in the coming week or two. We have a network analysis that we are conducting across state and local levels. And we have done that in the past as to look how organizations are communicating with one another and what the networks look like between organizations. And in this set of evaluations for the 15 and 16 and forward sites, we will also be doing social networks based around the young person who's receiving services. And we expect that will be very interesting in understanding whether services actually are wrapped around the young person and how the young person perceives the networks that are providing services and care to them, both formally and informally. And then we have some geographic information survey work looking to see whether information is expanded. Here's our timeline for data collection. We have stars at the end because we consider it a good thing to collect data. And you can see that we have submitted data collection instruments for Federal Office of Management and Budget Clearance. As you might know, we are unable to collect data on a national initiative like this funded by the federal government without approval from the Office of Management and Budget. We've submitted those instruments, and we are hoping that they will be approved in the spring of 2017, so about 6 to 8 months from now. As I mentioned, because we have prior approval for the child and family instruments, we can implement those sooner than later. In the meantime, for those of you who have worked with us, you know that we're introducing ourselves and getting to know you. For those of you who work with us longer, we provide a number of types of infrastructure and webinars about the national evaluation. We're building internally our infrastructure for data collection and management systems, and we have data collectors here who will be providing data collection, and we're getting those all trained so that way, as soon as OMB is on board, we will be able to get going with our data collection. Now, we do provide support to grantees. We have support from the SAMHSA eval at westat.com. We have training and technical assistance on data collection, reporting, and evaluation. We have a webinar series that's underway that we're getting some terrific help from Beth on. We have an email help desk for grantees to contact the project team. That's right below, SAMHSA eval at westat.com. And we have site liaisons assigned to each grantee as one central point of contact. And now we'll talk for a second about the Child and Family Outcome Study, because we know it's an area of special concern. We do use the Child and Family Outcome Study to describe the number of demographics of youth and families who address system of care services. We do want to look at the individual family characteristics of the youth served, so we want to know who you serve, and then we want to know how their outcomes and experiences change over time. So we use them both to look at who you serve and also look at how there's change over time on key outcome indicators. It's obviously very important for us that you do child and family data collection, and we think important for the initiative and for all of you. It gives us a sense about how youth and families are experiencing your systems and systems of care. It can be used at your local level to inform service delivery, to engage in quality improvement programming and service provision. We can use it locally, you can use it locally, or we can use it nationally to develop better policies. And it provides information about the outcomes associated with systems of care. And I'll note that I do see some chat coming in with some questions, and we're taking a look at them. We'll be sure to respond. We do have one I'll just go ahead and address, which is, well, will the instruments used for the Child and Family Outcome Study measures be desk instruments or completed with youth or family members? And the ones we're doing for the national evaluation are primarily ones that will be completed with the youth and or family members. The data will be used. You'll have access to your data. So anything you enter to our system that we'll have for you, you'll be able to get back in an analyzable form.
And you can just leave it here or put it on my desk upside down there.
And then we'll be aggregating child and family data to complete reports and presentations on behalf of SAMHSA to summarize the findings from the national evaluation, including a very important annual report to Congress that will be completed over the summer. So I'm going to say something about the national evaluation and TRAC. And so if you're wondering who you collect these data on, this is where we have one of our links to TRAC. We ask that you collect your child and family data on the same population that you're reporting for NOMs to TRAC. So that should hopefully make things more straightforward for all of you. If you're wondering about which population you'll need to enter into NOMs and TRAC, that's something for you and your GPOs to sort out if you are still have questions about that. So you can see that for the national evaluation, we are focusing only on the System of Care Expansion Grant Program. TRAC, however, is a much broader system. It's used for data reporting by all SAMHSA-funded grantees. In the national evaluation, we're using some new and unique data collection requirements. They are separate and different from TRAC, and they will be collected actually through a separate and different data collection system. And TRAC has data requirements, including the National Outcome Measure Survey data, GIPRA requirements, and so those are different. The Child and Family Outcome Study for the National Evaluation are asked of caregivers and youth. And TRAC has NOMs questions specifically in TRAC that are asked of caregivers or youth. So we have multiple perspectives in the national evaluation built in for some of the young people you serve, and NOMs questions in TRAC are of individual, they can be either the caregivers or the youth. Again, the TRAC data requirements, processes, and implementation status are different and separate from the National System of Care Expansion Evaluation, although we tried to coordinate this as best as we can, and we do not have duplication generally of items between TRAC and NOMs and the national evaluation. We just have some small duplication to allow us to link files. We are not involved at the System of Care Evaluation in TRAC implementation, even though it is currently being done at Westat, and those folks are down the hall. We are not responsible for that. And your SAMHSA government project officers can address TRAC-related questions and concerns. And we also have, that we'll give to you later in the presentation or at the end, a TRAC help desk number that you can contact directly for questions and concerns. So as we said already, the youth and caregivers are being entered into NOMs, and the TRAC system are eligible for Child and Family Outcome Study. And our goal is to collect data on all the eligible and interested youth and caregivers receiving services within the System of Care Expansion Grant site. So to be included, we generally think that respondents will need to be receiving services within your system of care, which makes sense. That's funded by the expansion grants. Meet your program eligibility criteria for system of care services. And actually, if you are a 2015 and 16 grantee, you will be able to collect data between the ages of 0 and 26 because we have some new instrumentation for those populations. However, if you're a 15 and 16 grantee, until we receive OMB approval for the expanded tools for the younger and older populations, it will be between 5 and 21 years old. Generally, to receive system of care services, you need to have a mental health diagnosis and have a participating caregiver participate if possible if the client is aged 5 to 17 years of age, and they have to provide some kind of informed consent or assent. So again, for the appropriate respondents, for youth, it will be 11 actually, and eventually up to 26 years old. Youth younger than age 11 will not need to respond. We generally receive a new consent for youth who reach age 18 during follow-up data collection because they're then of the age where they can consent. Caregiver respondents may well be someone other than the biological adoptive or foster parent. As you know, these young people may have different folks who are in providing care to them, and we understand that that may change over time, so we do not have to have the same respondent for a caregiver for 2 different time points. We understand that the person may not have custody of the child, but we do require a consent form from the legal guardian if the person is under 18, and we do hope to have one adult respondent included during each data collection interval. So again, who's interviewed? Caregivers, child, and adults, depending on the age. And how is it collected? Well, the grantees, that's all of you, will interview youth and their caregivers or young adults using the outcomes instruments. At Westat, we have approval and responsibility for gathering the data from you. We get it in a de-identified format, and then presenting and analyzing the data, but we cannot collect it directly from young people and caregivers. You all will collect this information on the clinical child and family functional outcomes and family outcomes. And you'll also get some administrative information from records regarding the services received. One of you asked about desk measures, and that's kind of the desk measure part. So you will have some things you'll be able to get from existing records. We will have a portal for data collection. You do not enter your child and family data into TRAC for the national evaluation. We creatively call it the Child Mental Health Initiative Portal. It's a website that grantees can access to enter data and we'll give you a training on how to use it. So one principle for all of us is you should never have to collect data until we've trained you and provided some technical assistance to you all. So we will be doing that before any collect data and have to report it through our Child Mental Health Initiative's National Evaluation Portal.
Abram, a quick clarification here from Tanya. The Child and Adolescent Family Outcome Study for the 5 to 21 versus the 5-year age group to 7 and the older age group, 5 to 11. Can you just repeat and clarify the data collection process there?
Sure. I'll go back to that slide so I can help clarify it. So we will, for all youth who are ages 5 to 17 through 17, we will ask a caregiver to participate. When a young person turns 18 and they're 18 to 21, or when we are OMB approved for the extension package for 21 to 25, then we will just have young adults participate because they are at that point considered young adults. And then for the child can participate from 11 to 17 years of age, and they will not have to complete forms if they're younger than age 11. And of course, young people 0 to 5 also will not be completing forms. Those will be done by the caregivers as well.
Okay, thank you, Abram.
Mm-hmm. I'll skip forward now to where we were. I'm sure you all want to know what are we using as far as standardized tools. We're using something called the Pediatric Symptom Checklist, which is a standardized tool that's been used extensively. Again, it's free, it's brief. It does not take very much time, and it really looks at symptoms. The functional measures, that is, how is the youth doing, how are they functioning in school, things like that, is something called the Columbia Impairment Scale, which is also a standard measure, and it is also very, very brief, and you can be done with a youth and a caregiver. And then we have a caregiver strain questionnaire, which is, of course, done with caregivers. And you can see that we collect a range of information from caregivers, family living situation, caregiver strain, and also some information on services received. The youth are asked about also behavioral health issues and functioning, and to the degree possible, services received. And young adults complete all of those kinds of items because they'll be sole respondents, so they can respond to behavioral health issues, functioning, their history and living situation, and the services they receive. So we try to have our measurement be suitable to the age of the person receiving services. We would like to collect the interviews at 3 time points maximum: a baseline, a 6-month follow-up interview, and a 12-month follow-up interview, or at the discharge interview, whichever comes first. So if you have multiple time points more than 3, we will not require you collect data beyond 3 time points. And that gets us to questions, which you've already been asking. So feel free to ask questions and to type it into chat, and Jessica or I can try to address them.
Looks like we have some questions coming in, so that's great. In the meantime, there we go.
Go ahead.
Abram, Elizabeth has a question.
I see it.
If a 12-month,
go ahead. After you analyze the data, we'll be able to get reports on the data relative to our state or in comparison to other states. Yes. We'll be providing you with reports from the data, and we'll actually be working as we begin this process with sites to get a sense about what kind of reports are most useful to sites. And we'll be able to compare it to other states or to other similar localities, or to the data from the initiative as a whole. It says, so if a 12-month interview is completed for a child, a discharge will never be completed, correct? Yes, that is correct. If you've gotten to your 3 data points and you get to 12 months, congratulations, you are done. Question, when will data collection begin? On the child and family data collection, if you are a 2015 site, we are already trying to get data collection going. If you're a 2016 site, we're going to be providing training on child and family data collection next week, and they'll be working with all of you to get going on that as soon as you are able. For the data collection, is this just for families, or is it directed towards all that are on the team? So we do have two different kinds of data collection that go on. There is data collection just for the families, and that is data that the grantees, that you all will collect. We also collect data that is directed toward various parts of your team, and I assume you mean the team that's providing services or administrating your grants. And we collect the data from your team directly. We will be interviewing you and also doing surveys. So to be clear, caregivers will be completing the assessments for children 0 to 5. Yes, they will. If you all know some way for a 2-year-old to fill out a form, we'd love to know about it. Looks like we're getting another question or two.
There's one, Abram.
Great question. Will we be able to get the raw data we enter into the system back out, or do we need to enter separately in our own database for our analysis? You will be able to get it back out. Once you enter it into our system, we will be able to turn it back around to you. It will be raw. It will also be coded with labels and things to make data analysis easier, hopefully. So we'll talk with you. Hopefully, being able to get the data directly from us will mean you will not need to have your own database for your own analysis, but you're of course welcome to do so. But we're trying to do everything we can to help you with your local process by giving you your data back as quickly as possible.
Abram, this is Denise. Can you confirm that that is for the national evaluation data only and not the TRAC data?
That is indeed for the national evaluation data only and not for the TRAC data, though Jessica can tell you about access to the TRAC data.
Anything that you enter into TRAC can be downloaded directly from the system.
So in both cases, you can get your data back. Clarification, you'll be doing interviews and surveys of both the teams providing services and those administering grants. Yes, we will. Mostly for those administering grants, but we do have some questions for the services.
Abram, will the national evaluation be using any of the TRAC data to augment the information that you'll be collecting through the national evaluation instrumentation?
Fantastic question. Yes, we will. There are many parts of the NOMs data collection process that we did not duplicate in the national evaluation, knowing that it should be available through TRAC. We didn't want you to have to do this twice and enter data twice. So we have a agreement with TRAC to have the data linked to the data that we're collecting for the national evaluation. So it is important that you do both data collections, not just because you need to as part of your grants, but also because we do need it for the national evaluation as well. We're just not administering that data collection process or the mechanism by which you enter those data.
Tamara's question about the PowerPoint below looking different from the one that was used today. The PowerPoint below is the orientation webinar that Westat did October 5th and 6th for new grantees, and the slides that are used today are a subset of those, and also a subset of those for the child and adolescent, the child and family outcome study training. And so we will make those slides available to you also, and I believe, Abram, there's another training on the child and family outcome study that is upcoming. Can you address that?
Sure. We have a training, and I'm sorry, my calendar's not in front of me, but we have a training scheduled, 2 of them next week, really geared to the 2016 sites for child and family outcomes study training. I'm not seeing additional questions at this point.
I have another one. Jessica, could you address how the portals for data entry are different, and what the implications are of that for the grantees who have to use these two different systems for data entry?
Jessica just pointed to me and said I should address that, Beth. So.
Okay, there you go.
No TRAC, so
I'll say our Child and Family Data Collection Portal, and Jessica can chime in with TRAC.
sounds good.
So for the child, actually the look and feel of our data collection portal for the child and family data collection and the look and feel for TRAC are similar. Not surprisingly, they were actually designed by some of the same programmers. So that hopefully will be helpful because you will be familiar with data entry and collection as part of the TRAC NOMs system.
No.
So there will be a data collection portal. It's a web-based system. You'll get login information, and you'll be able to, for the child and family study, and you'll be able to go in and screen by screen enter the data that you collect. I'll say also for the child and family study, we're evolving that system. Right now it's really a data entry system. With any luck, within a year or so, it'll also be a data collection system that you'll be able to use to collect the data directly. But at this point, you'll collect the child and family data in whatever way you choose, probably on paper, or if you have other ways, you can do it that way too, and then you'll be entering it into a data entry system. For TRAC, Jessica?
Yeah, initially we had planned on creating what some of the other programs have. It's called a Section H. So you would enter the NOMs data and then be taken to, essentially ported to a separate instrument within TRAC. But that whole process got stopped about 2 years ago.
Yeah.
So that's why, Beth, I couldn't answer your question. I haven't seen the SAMHSA system in 2 years.
Right.
Right. Okay.
So right now, you go in and enter the TRAC NOMs, and you enter SAMHSA data separately.
Just addressing the files for download, I see that one of the documents up there is a list of the web events that Westat, through the National Evaluation, will be providing for you on topics that are related to the evaluation. So you have that resource there, and now it also looks like you have the PowerPoint from today's learning community. We will make available also the PowerPoint from the orientation webinar to make sure that you have that handy.
And we at the National Evaluation also have quite a few webinars, as Beth noted, that we've done, both just training on the National Evaluation and also a series of webinars that Beth mentioned that provide additional information about evaluation in general. And if you need copies of those, you can also, of course, ask us at the National Evaluation as well. And I think there's a question saying, will we receive invitations for all the webinars listed in the attached PDF? And I believe, Beth, the answer to that is you will now.
Yes, you will receive them directly from Westat, but also they will be listed in the TA Telegram as upcoming events, and you can click on them in the TA Telegram and register for those webinars and web events through that mechanism as well. If you are not already subscribed to the TA Telegram, please make sure that you get in touch with us, and we'll send you the link to subscribe to that, and make sure you get all of the resources and all of the announcements that we include every Monday in the TA Telegram.
Any other, it looks like we're getting another question coming in. Oh, we'll take a thank you. Anything else? While you're thinking, I'm just going to take us through briefly with our liaison information, just so you feel free again to type in some questions. These are for the 2016 sites just only for this point. We have liaisons assigned to each round of sites. If you have curiosity or interest in knowing who liaisons are for other sites, just let us know. June Crandall is handling our System of Care Expansion and Sustainability project in Florida. 2016. Beth Flashner is doing Tennessee, Virginia, Hawaii, where I intend to travel if at all possible, New Hampshire and New Hampshire. Angela Green is handling Colorado, Massachusetts, Puerto Rico, Kansas, and Texas as 2016 grants. Glennis Jared Coker is handling our grants in Missouri and 2 grants in Pennsylvania. Don Nelson is handling the New York State Youth and Families Achieve in New York and the County of Rockland, New York. Jerlyn J. is handling our District of Columbia, our Early Development Project right around the corner here in DC, and the Bridges to the Future expansion of care expansion here in Maryland. Rebecca is working with our Missouri grants. Liz Papachan is working, was working on Mississippi grants, and Liz Papachan is working with our Missouri grants. Dushama Rajapaksa is working with Cuyahoga County in New York. And Viola Sampson is working with our grants in California, in Indiana, Ohio, Illinois, and Nebraska. Sorry, I forgot the apostrophe there. Ayamati is working with our tribal grantees in Oklahoma, Arizona, New Mexico, South Dakota, and in Alaska. And those are our evaluation liaisons.
Abram, can you discuss their role a little bit?
Sure. The evaluation liaisons are going to be your one-point initial contact with our national evaluation. Our National Evaluation Help Desk, CMHIEval.com, where you can send a note to, you can get responses there, but you will also firstly want to just reach out to your liaison. If you haven't heard from your liaison yet, you will very soon. And we will be doing introductory interviews and also trying to introduce you to the liaisons through that process. So the liaisons are really your initial contact. They work as a team, and we all work to support them, but they'll be the ones working directly with all of you as grantees. Just going back on the PowerPoints here. Wanted to get you all, we won't be able to get there very easily. I just wanted to again note that you can get us at CMHIEval.com for an email address. And Jessica, do we have information for TRAC?
Yes, TRAC help at Westat.com, TRAC help at Westat.com.
So TRAC help at Westat.com.
And the phone number is 1-855, but if you email them, they'll respond to you, but 1-855-796-5777.
So if you have TRAC questions, please use that one. If you have national evaluation questions, please contact your liaison if you know who they are, or contact us at samhieval.com. And we do talk back and forth. So if you get it wrong, don't worry, we'll forward it and figure it out.
Right.
Okay, so apparently the link to the TA Telegram to subscribe, we are unable to put in the chat box, so if you will email Denise, she will get that to you, and you can subscribe to that and all of the other resources that are distributed through the TA network. And I hope I got the email address for the evaluation and the phone number for TRAC correct. And then it's TRAC help.
Right, TRAC
at
help.
Westat, right?
Mm-hmm.
We will also send a link to subscribe to the TA Telegram and the follow-up email that you'll receive.
Yep.
All participants will receive an email with a link to the recording for this webinar.
So if you missed anything, you can go back and find it again.
Other questions? We are aware that as new grantees, you are getting contact from a variety of different individuals. Your evaluation liaison is one of them, but you also, of course, are getting emails and calls from your government projects officer. There's a grant management specialist for all of the management and fiscal issues and program operation issues. You have a lead TA consultant from the TA network who's available to work with you, and also a technical assistance support coordinator or task working with you. You have a social marketing consultant. So there is a lot of support available to you as you begin your initiative, but we also recognize that it's a lot of people to deal with and a lot of calls, and we want to make sure that that's clarified for you and that the various roles of these individuals are spelled out, and that you know that the evaluation liaison is somebody that's your first line of contact with any of issues and questions you have around the evaluation. Other questions? Okay. I think we can try unmuting the lines to see if anybody would like to share anything that way. Can we do that now? Okay, so dial *1 to unmute your line if you'd like to share a question or a comment at this point and continue the dialogue on this. Okay, it seems that maybe we did a great job and answered all the questions you have on the evaluation and on TRAC. We will be available. Abram will be available. I'm sure Jessica will be willing to take questions, and we at the TA Network will also be available to triage your questions to the right place. As I mentioned, there are a lot of support people available to help you as you begin these initiatives, and their various roles. We are trying to coordinate and make this seamless for you as you conduct your work to expand systems of care. Again, we can end a little bit early, and I want to remind you once more that the next Learning Community meeting will be January 18th. Your social marketing plans are due at the end of year one. We will have people from the Caring for Every Children's mental health campaign on that call to give you some guidance about the social marketing plans and what they might look like and some examples of plans. And then there'll also be a significant amount of time to discuss Mental Health Awareness Day that'll take place in early May, and how that can augment and be used as an anchor for the social marketing and communications activities you'll be using to support your work. So with that, I would like to thank Abram and Jessica very much for joining us for this Learning Community meeting.
Thank you,
and
everyone.
we look forward to having you all participate to our January meeting, and we will be having them in subsequent months as well. And you check the TA Telegram, please, for those future events, and we look forward to having you participate in those as well. So thank you all so much, and enjoy the rest of your day.